Hello, this is Danny Blyth from the College of Integrated Chinese Medicine, looking at pulse rate and rhythm in Chinese medicine. Remember, this is for Chinese medicine students only. Please pause and read this. So we'll look at pulse rate. So remember, there's a spectrum from a very slow, normal, rapid, very rapid. And we'll look at the pulse rhythm. So we've got an intermittent pulse, which is regularly intermittent. We've got a knotted or a bound pulse, which is slow and irregular, and we've got a hasty or a skipping pulse, which is rapid and irregular. So the purple writing are things that you need to learn if you're a Kickham student. So normal pulse is considered to be 4 beats per breath, so inhalation and exhalation, and here are the normal rate for different ages. So from 90 for very young children to 68 for people over 50. So a rapid pulse is one that's more than 5 beats per breath or more rapid than normal beats per minute. If it's full and rapid, it means there's full heat. If it's empty and rapid, it means there's empty heat, yin deficiency. It can be after a shock, and this shock can remain long term. It can be severe overwork. If you've been seriously overdoing it, you can get a rapid pulse. It can be nervousness, so often patients' pulses are choppy. They're rapid at the beginning when you first take it, and then they slow down. And rarely it can be false heat and true cold. Slow pulse less than 4 beats per breath or reduced beats per minute. If it's weak and slow, it means there's yang deficiency and empty cold. If it's strong and slow, it means that there's full cold. It can mean that there's qi deficiency and the pulse just isn't moving around the pulse quickly. It can also be somebody that's extremely physically fit. So if you get an athlete, they're likely to have very slow pulse, and this often matches their respiration as well. So an intermittent pulse skips beats regularly, so you get so the more regularly it is, the more severe the condition. If it's intermittent deficient, then it means that the Zhang organs are exhausted, especially the heart. If it's intermittent and rapid, this can be wind, it can be severe pain, it can be injury, it can be shock, emotional shock. It might be that the middle jiao is deficient in cold. Often get this if somebody's seriously dehydrated, or it may be just a congenital normal pulse for that person. So the Mai Jing says the intermittent pulse stops and is unable to restore itself and subsequently moves again. The hasty or the skipping pulse is rapid and skips beats irregularly. So if it's hasty and full, excess heat or fire with obstruction, the obstruction can be qi, blood, food or phlegm. If it's hasty and deficient, then severe depletion of the Zhang organs and of yuan qi. It can be, if it's severe, that yin and yang are separating. Again, it can be a congenital or a normal pulse for that person, and it's described as agitated and urgent, or like a man running and suddenly falling down. The Mai Jing says the hasty or the skipping pulse arrives and departs rapidly, and at times 1 beat stops and then comes again. So rapid and irregular. So a knotted or a bound pulse is slow and skips beats irregularly. So if it's knotted and full, it means that there's a stagnation of cold, possibly a stagnation of phlegm in older people, or a stagnation of blood. If it's knotted and empty, then the heart qi or the heart yang is deficient and there's empty cold, and there's usually a stagnation of blood as well. It can be that the yuan qi or the jing is quite depleted, and again it can be just a congenital or a normal pulse for that person. And the Mai Jing says the knotted or the bound pulse comes and goes moderately. Intermittently, 1 beat stops and then returns. So the choppy pulse doesn't really belong here, but I'm discussing it because it gets mixed up. So it can feel irregular, the 3s and the 5s not adjusted. So it can feel irregular because the quality or the strength are irregular. Or it can feel like it speeds up and slows down, so it can start off quite rapid and then slow down. So it's not missing any beats, but it feels irregular. And the choppy pulse tells us either that the body fluids are deficient or that there's a stagnation of blood. So that's pulse rate, slow through normal, rapid, and the pulse rhythm, so intermittent, regularly irregular, the knotted or the bound pulse, slow and irregularly irregular, and the hasty or the skipping pulse, rapid and irregularly irregular.